Hello, welcome to Brain Club, the podcast, a space for learning, unlearning, and reimagining new ways of being together in neuroinclusive community. I'm Dr. Mel Hauser, Executive Director of All Brains Belong Vermont. Welcome to our brand new podcast. Brain Club is All Brains' full weekly community education program where we demonstrate our approach to neuroinclusive culture through community panels, guest speakers, and book chats. It's a place where we shift broader community awareness about the issues of concern and importance to neurodivergent people in our community and promote new ways of thinking and being in community together. It's a place where we transform culture by modeling what's possible with the idea that then you go out into the rest of your lives and carry it forward. You can already access all the recordings from our website at allbrainsbelong.org, but our community asked us to turn it into a podcast, so here we are. These conversations are not medical advice and they're not support groups. They're an invitation to think differently about health, connection, and how we build systems that include everyone. Each episode features community panelists sharing perspectives and lived experiences. We hope you'll listen with curiosity and reflect on what it brings up for your own life. This is part 2 of our conversation about autistic life experiences. In part 1, back in episode 10, we heard from All Brains Belong community members about their experiences discovering that they were autistic for the first time in adulthood. We return now for part 2 to double-click on specific experiences receiving or trying to receive healthcare as a late identified autistic person. In this episode, we hear from community members at All Brains Belong sharing their healthcare experiences before they joined our community. Unfortunately, the topics you'll hear are heavy: systemic ableism, discrimination, medical trauma, gaslighting, invalidation. Please take care of yourself while listening. Unfortunately, these are not rare stories. Neurodivergent people are commonly misdiagnosed, dismissed, blamed, and harmed by a system that wasn't built with us in mind. This conversation names the patterns so many of us recognize and makes space for others to feel less alone. This conversation names the patterns so many of us recognize and makes space for others to feel less alone. Thank you to our panelists, Sarah Knutson, Matthew LeFluer, Amy Noyes, Linda Riddle, and Zeph. Thank you for sharing your stories. Let's get started.
When you think about your experiences trying to access healthcare, what comes to mind?
It's very hard to access healthcare. I think it's hard in general. I think our system is broken for pretty much everyone. But the amount of additional layers that come when you have, in a way, any type of disability, just it makes it truly a monumental problem.
When you think about your experience trying to access healthcare, what comes to mind?
This is going to be kind of a bummer of a conversation, so here's a content warning because I don't have a whole lot of really great healthcare experiences. I have medical PTSD. When I think of the healthcare experiences that I've had, a lot of them have been very challenging, particularly from communications perspectives, trying to make myself understood to the doctor and being understood.
What comes to mind is a doctor or a physician or the nurse, willing to understand that this individual is different than all the others, and how can he or she adapt to that individual needs. But with me, it's more about, will this doctor, nurse, physician accept me for who I am, not what I am.
Obviously been autistic my whole life, but I didn't know I was autistic. So I never knew what the challenge was. And I think about myself even as like a little child and someone had to put attention on me or had to touch me in any way. I think I had a real fear response that I'm just starting to really start recognizing. And I didn't always felt like I was asked permission. And that I realize in retrospect is huge. So I kind of didn't access healthcare, or accessed it very, very minimally.
Even in emergency rooms, like not being able to tolerate the environment and being, potentially written down as an uncooperative patient because I had to leave before they were done with their stuff because I just couldn't tolerate it.
What are some challenges that you've faced in accessing healthcare?
The challenges that I face accessing healthcare is the accessibility formats, documentations that they give you, new patients or existing patients, forms that you had to fill out per meeting when you get there for your doctor appointment that day, which is, is not accessible.
It was very anxiety producing for me. The thing I think is like what I've recognized, even in like a basic wellness exam, there wasn't a connection. I didn't have a connection to my body, and I didn't have a connection to understanding why the question was being asked. So if I went to a wellness exam and they're like, tell me about your teeth, and I would just be like, I don't know how. And because I'd be so anxious, I don't think I had access like to my fully functioning, like speaking. I just wouldn't know what to say.
Nobody believes you. And then there are different levels of that in, well, you look at it wrong, or you couldn't possibly know yourself because you're this subgroup or that subgroup. And then there are the ones where, well, everybody looks fine, so it has to be fine. And I found that a lot as a parent, that I would know something was wrong, but my kids didn't look disabled. Oh, they looked cute and perfect and just the right amount of chubby. But no, I'm just one of those moms.
Yes, the difficulty healthcare system for me was the physicians of trying to understand my complexity of my learning knowledge and how I learn and how can they adapt to my learning. For me, it's more about, not only speaking to them on that same level, which is very, very tricky, but also complexity of the healthcare system in itself, because they're running on the medical terminology of the healthcare college insight. And when they use those or explain those to patients, sometimes patients like myself with disabilities cannot get it because it's, it's like you're teaching a seminar at a university, but you're doing it with a patient.
Well, she has staring spells. Well, she can walk a straight line and touch her nose, so there couldn't possibly be any neurological difficulties. And it's coming from otherwise knowledgeable people. You start to wonder, where is the problem? I have spent a lot of time not getting a lot of things. And part of it was, well, maybe this is just something maybe I am wrong. Maybe there's this big cosmic thing that 95% of the populace gets and I don't get because I'm me and I don't get it. And I didn't know why I didn't get it then, but I just knew I didn't get it.
Right.
But no, it wasn't me this time.
A lot of different symptoms show up in the different systems of the body that were fundamentally neurologically related.
Long COVID, and other, medical issues like asthma. It's, it's very common, but it's also things that should never be ignored in the medical profession field, because those could complicate, the lifespan of an autistic adult or child.
Even though I talked with them about the other symptoms of the autism, my symptoms were brushed off as PTSD.
And I can just feel when I walk in, I don't know if it's a safe space for me. And I don't know that it's like a safe space for me, like being neurodivergent, but I also don't know if it's a safe space because of the way that I'm going to be treated and disregarded in terms of like, just go lose weight. I'm terrified to go. I think there's a lot of assumptions being a fat person. And so like, if I go get my blood pressure checked or something like that, there's this like quality of, oh, I can't believe that you have normal blood pressure. Like just like the things that people are saying to me, I just recently had a routine mammogram, and like what was said to me during that appointment was incredibly inappropriate.
When I came to Vermont and, I moved here, so you had to get a new medical home, this old country doctor, nice man otherwise, took a look at me, weighed me, and signed me up for like the entire list of every health test you could possibly have. And I'm like, I don't really want to pay for all these, but okay. And then I was like, no, we don't need to do the cholesterol. At least I know that one is fine, because I'd had it done recently and I inherited low cholesterol from my dad. And he wouldn't believe me. So we ran the test. And my cholesterol actually had gone up. And I said, well, should we worry? Because it's gone up 6 points in a year. That's the most it's ever gone up. And he told me to be quiet. And I was like, okay. And I couldn't really voice anything back for me because we're trained not to do that.
Well, how is your menstrual cycle? And I was like, fine, great. Well, when was your last cycle or whatever? And it was like, I have no idea. And I immediately was yelled at. And what they said to me was, and I started crying, and they said to me that it's my job. Like, I always think it's a good sign when people are crying, because it's my job to make sure. And if I have to yell at people to make sure that they're taking care of their health.
Going through that time period was super frustrating, trying to get attention and going to all these different specialists and not getting a whole lot of answers. So many of these experiences are me advocating for what I need. It took me 5 years to get a diagnosis for my autism.
My healthcare provider said, well, we can't say you're autistic. Or my chiropractic care was no, there's just no way. Not asking me, not curious at all. Not saying what makes you think that you're autistic, or how could we find you an autistic specialist to figure out, or
to give you some idea how powerful it was. Number one, learning that I was autistic was like a kaleidoscope coming into focus for my entire life that made everything make sense. And I was also diabetic at the time. My blood sugars literally dropped 20 points overnight and stayed down with the self-diagnosis of autism.
I find that hypocrisy bothers me a great deal in general. And, we're supposedly a society where we're supposed to take care of ourselves and be informed and make decisions and be self-actualized and everything. And even if you're all those things, and in many ways, if you are those things, healthcare isn't designed to work for you. It's sort of designed for you show up and they send you places and put you in little cubbies and folders. And if you actually are no, that doesn't actually affect me. This over here affects me. Nobody quite knows what to do with you.
Doctors, I don't think, are really taught how to work with patients who don't fit the expectations of, what the profile is. They're trained to make decisions in a very specific way. They need to, in order to be really good with their time.
Because nobody else lives in your body but you. So you would think after a certain amount of time, you would become an expert in it.
Yeah.
I mean, that's kind of how I look at mine.
Yeah. Thanks.
Knowing that just because somebody shows up in front of you and may appear normalish enough, but there needs to be given some amount of space or grace to allow for the fact that maybe this person has other things going on that you don't know about?
I try very hard to communicate, but then when I get frustrated, I become very blunt. And the new doctor I have, he at least can deal with that.
Mm.
But a lot of people in healthcare are still sort of trained in that, I am in charge and you are here at my whim sort of thing. And, we must be respectful. There's so many different layers of those nuances that I'm like, no, I had to wait 45 minutes for you.
I could never go back. So in that one moment, and I went to therapy, and we're starting to get all these strategies of how do I go back. And that's when I found ABB.
I was going through another round of low mood and fatigue and sort of growing hopelessness about the possibility of having a future. I had pretty much exhausted mainstream healthcare options, or at least the mainstream healthcare options I was willing to try. I was sitting with this friend over coffee who was the director of the Vermont Disability Council, and she was raving about this new doctor in Montpelier who was out as autistic and starting a medical practice. So,
what do you wish healthcare providers knew about neurodiversity and neurodivergence?
It's really I want them to know about ABB. I want them to know what Mel has figured out. I want them to know this connection between all of the things, that I wasn't waking up in the middle of the night with panic attacks. I was waking up because I wasn't breathing, because I needed a sleep study. I was waking up because I have dysautonomia, because my autonomic nervous system doesn't work correctly. Everyone was putting this on me, that my thoughts were causing these panic attacks. I don't know who has panic attacks. I wasn't having a thought in the middle of the night. And the way in which Mel has reframed that it's my fault, that I'm not doing something correctly, that I'm broken, which is, I feel like what the healthcare would say, you're not doing enough. And what I hear Mel saying is, no, the medical system isn't doing enough for you. And so that's what I would love to say, is that if the medical care system didn't blame people who have difference, that instead was curious about that.
And we have made some, not enough, but some progress over the last 40 years, learning to accept people a little bit, to give people a little bit more grace, a little bit more space to be themselves when we can tell they need it. But if you look like you should fit, and then you don't, people get cranky. And if the cranky people are the people that we're relying on to give us the referral, to actually listen, to think about what we're saying and try and put the pieces together in the areas that we aren't knowledgeable about, because nobody can know all of this stuff.
Mm-hmm.
And if they're just grumpy because we don't fit what they think, no.
For me, I see this, process of the healthcare industry is starting to come around and understand neurodivergent individuals and neurodiversity.
Having curiosity around my experience, asking me, do I understand where the question is coming from? Providing a space that I can feel comfortable in and safe in, helping me make connections back to myself, not making presumptions about my body, but asking me if that makes sense. Finding ABB is just I've said this to Mel, I've said this to a lot of other people, but it's I just know I'm going to live longer. I can't imagine being yelled at. I can't imagine not being cared for. I think the whole first wellness visit that I had with Sierra, I think I bawled the entire, I just remember my shirt being all wet because I couldn't believe the care that I was getting. And I couldn't believe the access, and I didn't even know what I needed. I had zero idea, and that there was all these different options. And so it's just so radically different for me.
The idea that we can just say, this is my access need. And if we can take that step to say, okay, we're going to actually look at this problem. What is the actual problem with access? What is the actual problem with communication? What is the actual problem with coverage? Oh, then maybe we can fix some of this shit. So I think that's what we need.
What I want providers to do across Vermont statewide is to understand the individual needs. If we can understand your needs, we need to be respected in the same way. And for me, it's more about, having that work individual participant relationship. Basically, you want the doctor to get to know you better, vice versa, the patient should get to know the doctor better. It helps move things along quicker and make the process more easy for both parties, the doctor, the nurse, and the physician at large. Plus, the individual patient would feel at ease, of coming back to those services.
So I did the intake, which invited me to share, like, among other things, what I care about, and also offered to have a provider spend time discussing things I cared about, which really impressed me. And among other things, like the possibility of sort of like, how do you structure an appointment in a way that it's comfortable to you and you feel comfortable? And I thought, and things I had never thought about as even possibilities of sitting in a doctor's chair with, a comfortable blanket or, pillows or, something like that, so that was like, oh, I could, and so that it was just nice that people thought about things like that. Mm-hmm. And then when I was sitting in the waiting room for my first appointment, there was a really short book written for kids. And it basically told my life story of losing it. I remember reading it, waiting for my first appointment. So sort of losing it and having these public meltdowns that I was so ashamed of. And it explained those things in terms of the fight-flight response, which I was totally on board with already. So, and then there was also something on the wall in the office about polyvagal theory, which I was also totally on board with already, and thought and was impressed that ABB knew about and was thinking about. And so at that point I thought, wow, it looks like these people speak my language.
And what I want to see forward is, that sense of belonging within the healthcare field industry, but also understand everybody's access need is different. We're all different. We're not the same. And for me, it's more about trying to connect, have that universal connection between each industry or each systems, and try to make it a collaborative system where it's cost effective and more efficient, because everybody wins that way if it's more collective than having these barriers or what you call silos that are preventing us from providing those services in the first place.
A really sincere attempt, the most sincerest attempt I've ever seen in a medical practice to meet people where they are at, to serve everybody well and to leave nobody behind. It's an incredible effort to make groups and meetings and medical care accessible and interpersonally, practically, financially. And I love that the practice is really developed in consultation with patients, and like we're in these advisory groups and invited to join them. And that what happens in the practice after that, how the practice develops, is informed and driven by what we say in those meetings, and basically informed and driven by patient needs.
I just didn't know that I would make it. And so when I say, like, I know I'll live a longer life, it's not only do I live a longer life because I have the healthcare, but now I have community, I'm making friends. I feel understood. I feel like all of the things that seemed so isolated in the issues with my health are now understood with very simple medications. It just changed my relationship to being able to get up in the morning, like limited my limbic response so that I actually can be here right now speaking to you. All of these things that ABB are providing for me. And then it's like the other patients are just, I learned so much.
This is just like so amazing to me. There are these amazing group medical visits where Mel and Sierra offer this cutting edge information, but they also allow lots of time for questions and in-depth discussion around the areas that concern us. And and beyond that, and there's more, because there's also an opportunity to meet others in the community who are going through the same or similar things, which then gives us the opportunity to learn from each other's experiences and to really value and feel valued by each other and feel a lot less alone and a lot more hopeful.
For many of us, healthcare isn't just ineffective, it's traumatic. But being in a space where your access needs are expected, where your patterns make sense, and where you are believed, that can start to shift something. We're so grateful to Sarah, Matthew, Zeph, and Amy for sharing your experiences. Thank you for sharing what you've been through and what has become possible. Thank you again to our panelists, Amy, Sarah, Linda, Matthew, and Zeph. If you want to keep exploring with us, you can join our live Brain Club events most Tuesdays at 6 p.m. Eastern. You can also dig into our free digital resource library with all the recordings from the past 4 years at allbrainsbelong.org. You're not alone, and we're glad you're here. See you next time.